Duran, and I will be doing the trauma assessment skill today. So first, I will begin by ensuring that I'm wearing the proper PPE. Now, once I have my PPE, I will proceed on checking my scene safety. So my scene is safe at the moment, and I will proceed on checking my mechanism of injury. In this case, my mechanism of injury is a motor vehicle collision. And then after I check my mechanism of injury, I'm going to be checking for the number of patients. In this case, I only have one patient. And I will be asking for additional EMS just because of my mechanism of injury. And again, because of this mechanism of injury, I will be holding C-spine. So I'll have my pretend partner hold C-spine for me. After that, I'm giving a general impression of my patient. So I have a patient in his 20s, laying supine, slightly pale, looking kind of diaphoretic, and a slight deformity to his right arm. After that, I will check for responsiveness. So I can now approach my patient. So, sir, are you okay? He doesn't respond. Painful stimuli, unresponsive. Now I check for my patient responsiveness. I can't check for a chief complaint since he is unresponsive right now. I can tell though that he is a high priority patient due to him being unresponsive. So he is my high priority patient. Now I will continue by assessing my airway. So his airway is open at the moment. He is having somewhat of labored breathing, so I will put him on oxygen right now. So I will put him on 15 liters of oxygen by non-rebreather facial mask. His breaths, again, as I said, they are labored. I will now proceed on checking my circulation, so I will check for a pulse. So he does have a pulse. It is weak and it is regular. Also his skin, as I said before, he seems kind of pale, clammy, and he is diaphoretic. So now, as I said before, I'm treating for bleeding and shock. So I already put my oxygen, but I will proceed on covering my patient once I finish with my physical exam. As I said before, he is a high priority patient, and I will proceed on getting my baseline vital signs. So here I will have my pretend partner get baseline vital signs on my patient. And since my patient is unresponsive, I can't at the moment get a sample history. So I'll have to make do with what I can get on the field. I will now proceed on my physical exam, so I will check my head. So here I'm checking for any deformities, any dippings in the head, maybe any cuts, any crepitation or anything. I'm also checking my glove to see if there's any blood on my glove. And since there is no blood on my glove, I can continue down to the neck. So I am checking for my neck. He has no JVD, he has no tracheal deviation, and his C-spine seems to be stable on the back, the cervical spine. I will then proceed on checking my chest. So I will palpate the chest. His chest seems sturdy and there seems no problem there. It's stable. I will now move on to auscultating my chest. So I will get my stethoscope. So I assess for breath sounds. And he does have equal bilateral breath sounds on both sides. After that, I can move on to my abdomen and pelvis. So my abdomen does feel tender and it is really hard right now. So I do have some suspicion of internal bleeding, which could be the reason as to why he is diaphoretic right now. I will then move on to my pelvis. So I check my pelvis and my pelvis is sturdy, and I can now move on to my lower extremities. So I will check my lower extremities. There are no deformities, no avulsions, no cuts, no burns, no contusions that I can see, but I cannot check for PMS as my patient is unresponsive right now. I will then move on to my other leg. Again, checking for any deformities, contusions, cuts, which there is none of that on my patient. And then I will also check my genitalia and my perineum as needed, because there might be priapism, which is a sign of spinal injury. I will now proceed on log rolling my patient towards me. So I will log roll my patient on the count of 3. 1, 2, 3. I am now assessing my back, to which my back, there seems to be no problem on the lumbar, thoracic part, and on the buttocks. So now I can return my patient to his normal state. And since he is hypoperfusing right now, I will cover him up, treat him up for shock, and I will reassess every 5 minutes since he is a high priority patient, and again, I will transport immediately.